but if I end up not doing it.
And I went ahead and did that.
First time you're here.
And
You
it took me-
innovator, you.
Sorry?
I said, you innovator, you.
Well, it was somebody else's suggestion, and just so ironic that it hadn't been done yet, right? All these years in the biggest search engine in the world, I forgot to upload these two. So I did create the channel, and I uploaded all of the videos dating all the way back. It took multiple days. You could only do 15 at a time, and then there was a daily limit, and then you have to publish them individually. It was kind of a pain. I hope that they get lots and lots of views. And that it's beneficial for people and not just a waste of time. All right, let me stop this slideshow so that you don't get. All right, so for those of you who have never been here before, can you just raise your hand? Every time. This is not your typical networking event. So we are definitely not going to go around the room and introduce ourselves. That would take us way too long. The program is too full with good stuff here. So 1 Million Cups, as I was explaining earlier, is actually started by the Kauffman Foundation out of Kansas City. And their mission, if you will, I don't think it's their mission, their tagline is to caffeinate entrepreneurs every Wednesday. So we have our caffeine and beignets courtesy of Beignet and Brew at the Avenue. And I encourage you to please go in there and say thank you to them, because it is really nice of them to have it ready for me when I walk in the door every Wednesday morning. The coffee is hot, the beignets are fresh, it's delicious. So what does it mean to caffeinate entrepreneurs? So I don't have actual numbers handy, but I did just get must have been like a half-year review from Kauffman, and the Southeast is still rocking it in terms of the amount of attendance and the amount of entrepreneurs served. I think we're not quite up at the top in terms of the number of organizers and volunteers. But David Conti, who must be on another call in another room, he is now an official 1 Million Cups organizer, so he'll be getting a pin that he can wear along with me and Abby. If anybody else is interested in that, let me know. They have trainings once a month. And there he is, our newest organizer. I'm just calling you out. You just came fresh out of the organizing training. Is there any little tidbit that you want to share?
No, it's very interesting how there is rules and regulations to this, and you follow them all to the T. I didn't know that was truly the case, right? But yeah, this is a big class of people who are leading multi-million cups all over the United States.
Yeah, it's really cool. And then this past summer, they did their first ever summit along with the Fast Track program, which for many years was a completely separate Kauffman program, and now the two are really kind of coming together. We are not doing our second cohort of the year here, but we will be sharing more information about it so we can kick it up again early next year. All right, so for those that don't know me, my name is Jason Bass. I own a marketing company, and I am passionate about building community, and I can go into what that means at a very deep level. I'm not going to do that today because it is not my time to stand up here. But my favorite thing that I do, community-driven, is night market, and that is coming up on Friday evening, October 3rd, 5 to 10 over on Drake Field. If you don't know where Drake Field is, just go to the public library and go down the hill, and you will see thousands of people and lots of food trucks and art vendors and live music. And it's such a good time, and I really hope that I see you all there. There will be a JHD networking lounge set up near the night market tent, and I encourage you to come and just network with your neighbors. That's all it is. It is not a sales pitch for JHD. All I like to do is bring people together. Sometimes I'm not even in the tent. I just like to watch it happen, and it'll be fun. So I hope to see you there. And what else? I guess pitch contest is really the next big announcement that I'd like to make sure you all are aware of. So Startup Fayette, Launch Fayette, the Chamber of Commerce, which Startup Fayette and the Chamber of Commerce are kind of one and the same, and Jason Hunter Design are all coming together in partnership to put on the 4th pitch contest, the Fayette Pitch Contest. This year it's going to take place, I stopped the slides, but I'm not even using the slides, sorry. Stars Mill High School Auditorium, November 21st, 18th, October 21st, November 18th. It'll be from 5 until 8-ish. We will have 5 people pitching in front of 3 judges. Those judges are going to have startup cash, or bucks, whatever we're going to call it, they'll actually be able to invest into each of the presenters. Yes, Jessica?
I tried to apply
Yeah.
yesterday
And
to
what
do a
happened?
pitch. It didn't ask me for the fee. I thought I had to pay a fee. And
Yeah, it should have redirected you to PayPal.
It just
so
said, you've gotten
$35.
your responses, and that's all I had. So,
Yours is free.
Thank you for bringing that to my
So can you let me know
attention.
if you got it?
Yes, I will check.
Okay.
I did tell you yesterday that a 4th one came in, but I didn't look at the details of it. I'm actually trying not to look at the details of each one until it's time for all of us to.
Yeah.
So I will, for your sake, and I definitely have to look at that payment thing. Thank you for bringing that to my
If you can,
attention.
send it to me.
Okay, yeah, I can do that. So there is a $35 application fee. At this point, I believe everybody who applies will have a chance to pitch on October 21st, which is technically the next scheduled Startup Fayette event. That'll take place here. And whoever is here is the audience. And the judges are really just the panel, the committee of people that are putting the event on. And then the top 5 will go on to the finals, which is again November 21st. So definitely put that in your calendar. It is 5 to 8 dinner time. We will have a food truck or 2 out in the parking lot available for you to purchase food from. You'll get to meet the people who are presenting. You'll get to meet the sponsors. It's going to be a really great event. So I encourage you, once again, put that in your calendar. What else? Okay, so most important, I should have started with this. It's why I stopped the slides. There is a QR code up on the screen. The QR code takes you to one of those Linktree style pages where there's a bunch of things that you can do. The most important thing that I'd like you to do is check into 1 Million Cups. You will have to create an account at 1 Million Cups. It's easy, no big deal. It asks a couple of questions. If you ever decide that you would like to present here, you already have the account. So you just have to go in there and fill out the very brief application to present. Choose Atlanta South. We get you approved, you choose your date. And on that note, I am very proud to say we are booked out through November
The first week of December.
First week of December. That's amazing. So, excellent. You know, I stand up here and I say that's excellent, and I am. I'm very happy. But I do want you to know, if you are hearing this for the first time, great. If I'm reminding you, 1 Million Cups format is actually 2 presenters per session. Can you imagine us only having 2 presenters, only giving the presenter 6 minutes and a hard 20 minutes of Q&A? Like, the people who come regularly, like, we know one presenter and it's an hour long, easy. So I am very happy that we're booked out that far. And yet 1 Million Cups would probably tell me it's time to double down and start doing 2 per session, but I'm gonna fight that for as long as I can. All right, so the other place I'd like you to check in is to Launch Fayette. Launch Fayette is an incubator, first of its kind on the south side of Atlanta, and there are stakeholders here who are making sure that the lights stay on. If you please would check in and let them know that you're here. If you're not comfortable with a QR code, online check-ins, if there's some issue, there is a piece of paper going around, and that's essentially, there's another one, but yeah, please. That's essentially the same thing. So if you checked in with the QR code, you don't need to put ink on paper.
Let me say one thing. I want to thank everyone here because last month we set a record for check-ins.
All right.
So almost 260 check-ins. That's people coming in for events, that's people that work here, that's people who come to our classes. And that's tremendous because we are funded through grants. And a great way to show that we are impacting the community is by the check-ins that we have every month. So thank you. Thank everyone here for checking in each week and helping us make that number big so we can keep going and get more money.
That's great. Awesome. Thank you.
That's a quick poll. Can you raise your hand if you do not live in Fayette County?
Yeah, you're in too.
Thank you. Appreciate it.
Interesting. Very interesting. I almost want to go further. How about, so of the people everybody who does not live in Fayette County, keep your hand up. For those of you that live in Coweta County, bring your hand down. So there's 4 hands. Can we just, county? Steve, you go first.
DeKalb.
DeKalb.
Henry.
Clayton. Clayton.
Hi.
Pike. Spalding. Look at that.
That's awesome.
Chatham.
Where's that?
Months away.
Are you a guest? You're a guest? Amazing. Amazing. Well, welcome. Once upon a time, there was a community of Women Lane Cups in Savannah, but I don't think that they've existed since COVID. So you'll have to just come back.
A couple other announcements.
Yeah.
Okay. So on the 28th, we're having Business Growth Essentials, and it's going to be about humanity and the human side of AI. So how do you beat AI? How do you compete in this world of AI as you become more human-centered? So hope everybody can come to that. It's free breakfast. We're going to do it. We're probably not going to do it this time here. It's going to probably be in another location. Still TBD. That's from 8 o'clock till 10 o'clock on the 28th. On the 22nd, we're doing our annual golf outing. We're already booked we're full with golfers, but we still have sponsorship spots left. And you can just show up and hang out.
And volunteer, right? You need volunteers still?
We do need a lot of volunteers.
Yeah, that's a great way to be engaged in the event because you'll literally get a chance to meet everybody. Whereas if you're a hole sponsor, we're kind of stuck on the hole. We only get to meet the golfers. So being a sponsor, volunteer is a really great way of getting to be involved. Awesome. Let's keep going. Valerie, would you like to speak about your upcoming event?
Hi y'all, I'm Valerie Alexander. I'm the entrepreneur in residence at Launch Fayette for culture, leadership, and narrative. And so in our ongoing series of courses for the public and for our members, next Thursday, a week from tomorrow, I will be doing culture, leadership, and narrative as a event here. It's going to be 9 a.m. to 1 p.m. and the way it's structured is from 9 to 10:30 we're going to do corporate culture, leading for the happiness of your workforce, how to ensure that you have a positive culture, how to ensure that the people who work for you are excited to come back and continue working for you every day. That's 9 to 10:30. We'll take a break, and then from 11 to 1 is the narrative part where anybody who has anything to pitch, whether you're pitching a company, whether you're pitching yourself because you're going to look for a new job, whether you're an entrepreneur at your company and you need to know how to pitch things to the people above you, everyone will have about 3 to 5 minutes to come up on stage, they'll pitch, they'll get feedback on their pitch, we'll improve it live on the spot. So that's from 11 to 1. So you can take part in either portion of that. You can be there for the whole day from 9 to 1 or 9 to 10:30 or 11 to 1. And it's free. We have opened it up to be free. And also, if you know of any local businesses that have managers where the business cannot afford to do any kind of managerial training, but boy, do their managers need training. Please share with them that this event is happening and please send them here because the managers who come in from 9 to 10:30 will walk out with better skills for people management. It's the one thing we don't train people. When we train them on management, we don't train them how to actually speak to the people who work for them. And that's what this session is about. So I hope everyone comes. I hope you send other businesses, and it's a week from tomorrow.
Excellent. All right. With that, I'd love to invite up our presenter for today. It's Dr. Randolph. I don't know why I want to say Randolph, but I come around front. Oh, no, yeah, that's right. That is for you. I'm just gonna switch.
All right. Good morning, everyone.
Good morning.
My name is Bridget Randolph, owner and nurse practitioner of Prime Direct Care and Medspa. I'm honored to be with you here today to share with you a healthcare model that is changing lives. My daughter and I were lying in bed watching Darman on the late Friday night when I got a text from one of my newest members, and it said, "Help, it's happening." Just 3 days prior, she was in the emergency room with dangerously high blood pressure. She was prescribed lisinopril and was told to follow up with a primary care provider. A friend of hers, who's already a patient of mine, referred her to me. She made an appointment the next day and came into the office. At our first visit, we talked. We really talked. I got to know her background, her family, her job, her lifestyle. I ordered labs, reviewed her medications, and educated her about the rare but dangerous side effect of lisinopril, a medication that she was recently prescribed from the ER. She told me she would be flying out to Florida for work the next morning. Then came the late night midnight text while she was mid-flight. Her face was swollen, her face was feeling tight, she was scared, but she had direct access to me. I knew immediately this was a mild case of angioedema, the dangerous but rare side effect of that lisinopril she got prescribed from the ER. We texted back and forth on the plane. I advised her to seek help as soon as she landed, but she refused. She was worried about ER costs. Her job was new and her insurance hadn't started yet. She didn't want to incur a huge bill. I stressed the importance of going to the ER, but she just wouldn't go. So I coached her through all of it. Her coworker picked up emergency medications from her local pharmacy where she was, and she took those medications. I advised them to park right outside the ER in front of the door, prepared to go in the event her symptoms worsen, because it can go from 0 to 100 based on those symptoms she was having. She did take the oral medications, parked outside the ER, but thankfully her symptoms did not worsen. The next morning, she texted and said to me, "You saved my life and you saved my wallet. Thank you." The purpose of this presentation is to educate you about direct primary care. This will save you money and sometimes your life. At the end of the presentation, I would like for you to connect me with individuals or small businesses that is looking for personalized, affordable, and convenient care. My company, Prime Direct Care, is based on the direct primary care model. So you might be wondering, what is direct primary care? Direct primary care is a modern, patient-centered approach to healthcare. It removes the middleman and replaces fee-for-service billing with a simple monthly membership. Think of it like a Netflix subscription or a gym membership, but with unlimited access to your provider. No co-pays, no surprise bills, unlimited visits in office or virtual, same day or next day appointments, and you can text, call, or email your provider directly. So why does this story that I just shared with you matter? In traditional healthcare, she might have been alone. In direct primary care, she had a lifeline. The average ER visits ranges between $1,500 to $20,000, sometimes even more. Her direct primary care membership indeed saved her life and her wallet. How much time does your provider spend with you during your regular office visits when you go? 3.5 minutes. How does that make you feel? Frustrated, right? Also, who here has that provider's direct cell phone number and can text them on a Sunday night or when they're in the grocery store buying vitamins? Okay, one person. You must have a DPC plan.
No, I just have the same position for 36 years.
Okay, so you have that DPC relationship. That's awesome. All right, so the average doctor visit in the U.S. is just 7 minutes. Lasts just 7 minutes. With this presentation, I want to focus on 3 key points with direct primary care: quality, affordability, and convenience. Number 1, quality. Traditional healthcare is volume driven. Providers often see about 25 to 30 patients per day just to keep up with insurance reimbursements. This leads to frustrated and fast visits, missed details, and patients just not being happy. With DPC, it's relationship driven. With a smaller patient panel, providers can slow down, listen, and focus on you. We catch issues early, prevent ER visits, and manage chronic conditions more effectively because we actually know our patients. Second point is affordability. With direct primary care, we offer blood work at up to 90% less than insurance prices. We dispense common prescription medications on site at wholesale prices. Common blood pressure medications is just so dirt cheap, there's pennies for $1. around $1.27 for 30-day supply. Sometimes you can get your medications for $5 for a 90-day supply. Third point is convenience and access. Again, patient waits are often weeks to sometimes a month just to be seen, only to be rushed through a 7-minute visit. And communication outside of that visit, nearly impossible. If you forget to ask a question during your regular office visit, you're out of luck. But with DPC, it's different. You can immediately text your provider on a Sunday night, be seen the same day, the next day. If you need refills while traveling or medical advice while traveling, you just simply call, text, or email. That's simple. Insurance has a place, right? But not for routine care. Direct primary care works beautifully with a high deductible and catastrophic insurance plans. Think of it like this. You want to use your insurance for big stuff like hospitalizations, surgeries, and major emergencies. And then use DPC for everyday care, blood pressure checks, minor infections, checkups, chronic disease management, and minor urgent care needs. So you want to not use insurance for those things because it drives up the cost for everyone. Just like you wouldn't use your insurance for your car insurance for like oil changes and changing filters. You don't want to use your insurance for simple little things that DPC can handle. By combining DPC with the high deductible or catastrophic plans, you get best of both worlds. Affordable routine care when you need it, and financial protection when you least expect it, by avoiding unexpected costs and high out-of-pocket expenses. DPC is not just for individuals, it's also for small businesses too. With direct primary care, combined with health insurance plans, you can really save a lot of money for your employees and also have them involved in a real great healthcare system that is less stressful for them. And it just works very well with catastrophic and high deductible plans. So if you know anyone who is tired of insurance delays, long wait times, and impersonal care, send them our way because they deserve better. Whether it's a small business owner, a patient, or a community partner, I encourage them to join the movement, empower their employees, and choose direct primary care. For just $99 a month, they get all the things that I just went over, and it's just simple and the best way of doing healthcare in today's day and age. Here is my phone number, email, address. Reach out if you have anyone looking for this type of care. I work with clients who are looking for a thoughtful and compassionate provider to help deliver quality and personalized care. I do help them navigate this complex healthcare system, and trust me, because I've helped so many people improve their life and their health. Choose me because I'm a board-certified family nurse practitioner and acute care nurse practitioner for nearly 15 years with clinical experience in family medicine and heart health. I combine my passion for family medicine and cardiovascular health to provide personalized and high-quality care. I've worked with respected organizations like Piedmont Healthcare, Cancer Treatment Centers of America, Optum Healthcare, and Grady. I specialize in managing acute issues, long-term chronic conditions, and the best part of all, preventative healthcare. That's my passion. As we wrap up, consider this. 25 million Americans are uninsured, and millions more are underinsured, skipping basic health care due to costs. Access to health care should not be a luxury, and direct primary care is helping bridge that gap by providing affordable, accessible, and consistent care for individuals, families, and small businesses. thank you guys this morning for listening, and I can answer any questions that you may have.
So, the first question is going to be, what can we as a community do for you? You were clearly coached, so you did tee us up for that in the presentation. I love that. Why don't you reiterate what it is that you'd like from us, and we can show you our support.
So there are, I meet people every day that, have health issues, whether minor or major, and just skip going to the doctor's office just because they can't afford it. And really, it doesn't have to be that expensive. I mean, a DPC membership is like a couple Starbucks a day. You can pay a membership literally every month. And so if you know anyone that needs, personalized, that kind of personal private healthcare, entrepreneurs that are busy, that doesn't have time to go into the doctor every day, this is the kind of model that works. So I would encourage you to refer them to me. And today I'm offering a free 15-minute consultation for anyone that wish to learn a little bit more about this model to see if it's a free fit for them.
Thank you. So I personally am a DPC subscriber,
Yay,
because
good
it's
for
a
you.
monthly membership subscription, right? So I can literally speak to, that story could have been about me. This isn't not a complaint, but it's more of a question. The only thing is that my DPC doesn't offer pediatrics, so I have 3 young kids, and I have to have a separate doctor for them. And I just want to point out, my experience with their doctor versus mine, night and day. Nothing but frustration. They are always closed and not available when I need them, versus always available and has every answer that we possibly need on the DPC
They
side,
have
right? So
DPC
I've heard there's
pediatricians popping
one in
up
the area
now.
as
Yeah.
of now, and they're not accepting any new members for
Yeah.
like years.
There's a lot on
So-
the north side of town.
Yeah, well.
Here.
So, I'm happy to also answer questions if you need about my experience, but let's certainly field our questions to her.
You mentioned that you have family plans, and you did say the $99 a month, which I assume is for an individual.
Yeah.
What age ranges are your family plans, and what is an overall, general cost for a family plan?
All right, so I see kids 12 and up. And for somebody 12 to 17, it's $49 a month with an adult membership.
Okay, thank you.
Great.
So,
What is your business model? How does your business model support the number of patients per practitioner? And what is your scalability?
so for DPC practices typically see about 600 to 650 max patient panel compared to the traditional, which is 2,000 plus. So, up to 600 patients, one provider can handle with, of course, nursing staff and administrative staff. But anything more than 650, I feel like you start losing the quality and the attention that the patients need, and you need to bring in another provider.
What is included at $99 a month?
Yes, so for $99, you get your free yearly physical. All the lab work that comes with the yearly physical, except if you're a woman, your mammogram is not included, but your pap smear is. Your pap smear, blood work, all of that is included in the membership. And then also you get wholesale discounted pricing with Quest, and also for medications. So if you're on medications chronically, it's dirt cheap. Like we get it, same place CVS and Walgreens and everywhere, all the major pharmacies get their prescriptions from. So that alone, for somebody that's on multiple medications, just even covers their membership and helps them save money that way.
No joke on blood work, like $4.
Yes, $3-4. It's
unbelievable.
So in addition to that, the annual physical, then what else can you just have like a monthly appointment?
So you can come in anytime you want. It's unlimited. It's virtual, phone, text, whatever you need. That $99 covers all your primary care services. Now, if you have chronic conditions and you need like labs and things outside of the yearly, that's where that comes in with the $3. Like diabetics, for instance, their A1C is like $4 every 3 months. So, you know, it's just designed to really be a cost-effective way of providing medicine.
Do you ever have a problem with an overuser, shall we say?
One or two. Some people, I have one of those that always cry wolf, and I keep telling them, don't do that, because the day you really have something going on, you know, I don't want to not attend to you. But yeah, it's not that often.
Bridget, like what? $4 compared to what? Like A1C?
Oh my
$4
gosh.
compared to
So
$100.
true story. I had one of my patients came in to see me for a yearly physical. It's a gentleman in his 60s. He's been with me for at least a year now, so he should know that his membership, the labs are covered under the membership. He went to Quest Fasting to get his blood work, and for some reason, the folks that were working there took his credit card and billed him for the visit. They were supposed to bill my account because that's what was clearly checked on the lab requisition, but they missed that and billed the patient. So for his yearly labs, that was the CBC, CMP, TSH, and a lipid panel. So a comprehensive metabolic panel. CBC is a comprehensive blood count, your thyroid function test, your cholesterol, and then the PSA for men, prostate specific antigen test. Those were the 5 lab tests I ordered. They charged him $940. And this is labs that with me is like $40. So that's the kind of gap, the scale, the difference that you see. I mean, it's crazy. Because what they do is they upcharge the insurance companies and then they tell you insurance paid for this portion and then you're responsible for that. But really, it's like you might as well just pay out of pocket.
Was the story you started this presentation with like the craziest like interaction you've had with a client, like middle of the night, or do you have more?
There's a lot more in my
There's a lot more fun.
Thank you. And next.
Health savings accounts, or HSAs, do they match up? They seem like they would be a great match for you as far as marketing
That
and
is-
client services.
Yes, that is a great question. So before HSA, DBCs were not allowed to use HSA for the monthly membership subscription. But now with the big beautiful bill, January 1st, 2026, you are now allowed to use HSA to pay for
So
your
you
monthly
can use funding from your HSA.
to pay for your monthly membership. It was not allowed before, all this time, right? It's
That
crazy.
should make a difference to this audience.
Yes, it's huge. So now HSA, you can use that for your monthly membership starting January 1st, 2026. That's part of the big beautiful bill.
And do you market directly to HSA?
We're gonna start now because before we couldn't because it wasn't allowed. But what now with the new bill, we are able to get that. Yeah, because it was against the law to use. But now, I mean, I don't know why they got away with that. That's crazy. You can use your HSA for a lot of stuff.
Yeah.
So
Crazy.
yeah.
I was
So
gonna say, like, Jason Hunter Design as a business can't pay for my health insurance, or it could have paid for my health insurance, but because this is not health insurance, it couldn't. So that seems like it could change. So when I was gonna ask you about businesses and how they could really benefit from this, because as a business, I was under the impression that the business couldn't, well, not as a business expense anyway. So that changes things.
Yeah,
That's great.
yeah.
I see it in way in the back.
You have a minimum of months to sign up, like, you have to sign up for 3 months or 6 months or a year?
No, right now you can cancel anytime. It's just when you first sign up, you have to be a member of the practice for at least 90 days before you get your free yearly physical and your labs. But other than that, no, you can cancel anytime.
Also, I'm full disclosure, I'm a patient of Bridget's, and I also have health insurance. Bridget can give you a super bill that you can apply to your insurance to.
That's correct.
So as a direct care provider, is that part of an overall network, like a franchise type of, or an association, or is each DPC completely independent?
It's completely independent. So just like a traditional healthcare clinic is completely independent and they have multiple clinics and they're not affiliated, DPC is just a model that's different from traditional healthcare. We just do things differently. We don't bill insurance and we have that kind of personalized care with smaller panels, patient panels.
Thank you.
There, if I may, there is a network. if
There
you
is a
will.
group, but it's
Right, they're not connected.
No.
But like, I think, I mean, I've been a member of DPC for probably 9 or 10 years now. And somewhere way in the beginning, we were in Florida and we needed, this was before
They have like a
telemedicine was
coalition.
real. Like, it was easy for a DPC to call another DPC and be like, hey, could you look at my patient or something?
Yeah.
And I don't know if we actually got that or not, but
No.
there is a network where they are at least aware of each other and can reach out to one another. Some certainly specialize in other things, right? Like, just like anybody.
Yeah, you can just go on that site and just put your clinic there so they know you are aware, but it's kind of individual.
And that network has grown a lot since we started all those years ago, so it should give you more comfort.
At one time, nurse practitioners were restricted in Georgia.
Mhm.
That's been lifted, is that correct?
Yes, we do a lot of stuff that primary care providers do. We have medical directors on staff, but this is the same things that we do in the hospital. It's just doing it on your own in your own practice.
If you're in the hospital and there's a physician making rounds, would that still work for someone that's connected with you, or would that go to your primary insurance coverage?
Say that again.
If you were in the hospital, how would that work?
So I actually still work at Grady in the heart failure clinic. So I do consultations whenever somebody comes in with severe decompensation of their heart. So I go in and do the consultation, see them, and I bill. The physicians can see some of them, but I do see them independently.
Are you an employee of Grady for that, or are you?
I moonlight because my passion is cardiovascular health. I've been doing it for so long. So they call me sometimes when they are like, you know, we need help. It's like 20, 30 consults today. Can you come in on a Saturday and see a few consults for me? And so I do that.
I will share that your presentation was great. I mean, first off, you have the storytelling, which is, this crowd knows that's mine. Like, please do that. And it was just fantastic. And you had a great line. You said, you saved my life and you saved my wallet. It's so good. I'm going to share that hearing now that you're a cardiovascular health specialist, I think that's a really powerful, I mean, I would love to have known that. So if you don't be afraid to do a little bit more about your history, how you got here and your expertise and your professionalism, and even times where like with the drug that was prescribed and then not explaining the yeah, I think we've all had an experience where a doctor told us something or chose something that wasn't for us personally. It didn't work in our bodies. And I think that's a really good selling point for you. And I know you have those stories where you're like, well, yeah, the doctor told the patient this, and then because they were one of my, I don't know, do you call them patients or clients?
Patients.
Okay, you say because they were one of my patients, they were able to check with me, and because I knew their medical history, blah, blah, blah. It's almost like concierge medicine.
Mm-hmm.
And
It is exactly,
it's
just
exactly that.
more affordable.
So, yeah, because I know about concierge medicine, I never heard the phrase NPC. So again, you may want to use that phrase just to gather people who have a mindset about it. But I'll share with you, if you're asking like how do you get more business or how do you get more awareness? I am a small business owner also, and every single year the selection of health insurance is probably the absolute worst time of my year. Like, especially now because it's so much federal support is going away on December 31st, and we are literally, like, what do we even do? And I don't know if you're a member of any Chamber of Commerce.
Yeah.
Oh, perfect. This would be just a fantastic session for a Chamber of Commerce for small businesses where you come in and say, alternatives and solutions for your health insurance needs. because I would love your advice on what yes, I know we need catastrophic insurance coverage. I know like bad things happen and sometimes that's $100,000 bill. I don't know what catastrophic insurance coverage to buy that then isn't gonna cost me literally $180 for every doctor visit. So if you come in and you say, these are the catastrophic insurance companies with the absolute best coverage to cover your giant horrible life events that aren't like $1,800 a month and won't bankrupt you even though you have it, combined with us. If you came and told my small business, I know what you're paying, $1,800 a month is not a made up number. If you say, I know you're paying $1,800 a month right now, you could get this catastrophic coverage for $600 a month and us for $100 a month, and here's how that would work for you, for your business and your employees. I would say take my money. And so I think an event like that, for a Chamber of Commerce, or even you can do it yourself, you know, book out this room and invite all the small businesses in town. I think that would be so valuable because the level of confusion around what insurance policy to get, and especially this year. This year it is the worst it's ever been because they don't even know what their rates are going to be next year. So we know, like I'm literally gearing up for November 15th. I have to make a decision about what our health insurance is going to be for the next year, and I can't even get an answer from the health insurer what they're going to be able to charge me. So any advice you can provide to small businesses is going to be such a boon. And then if you said, oh, then it's $99 per month per employee, or even we have a group plan where for $500
And
a
it's usually,
month.
it's typically cheaper, even more than 99 when it's a large group.
Oh, it would be so valuable to any small business in the community.
That's great, thank you.
I don't see any other hands up. We do.
Oh, Lisa.
You have a doctor associated with your practice, right?
Dr. Eva Boulieu. We worked together in internal medicine at Piedmont Henry for years. And so she's behind the scenes and helps, keep everything afloat.
And Valerie, I can help with that. I'm a health insurance agent.
And I saw your hand up there.
Yeah, I was curious of the difference between your training and a doctor. I'm just ignorant to that.
So it's a different path. So a nurse practitioner would typically have their 4-year bachelor's degree in nursing and then go and get their master's another 2 to 3 years, so 6 to 7 years. And then I went back again and did postmasters in acute care. So I did my 4 plus 6, so 7 to 8 years, but it's a different kind of track, which medicine, they do their 4 years bachelor's and then 4 years of med school, and they do the residency for 2 years. So that's that.
Just a thought, because if I have the question in my mind, I'm sure other people did as well.
Yes.
To maybe touch on that, it's like I have just the same amount of training as a doctor. I don't have the title, but because then that shows that I'm getting all the same value as a doctor.
Yeah, so in primary care, it's really, we treat the same things, the same way you treat blood pressure, diabetes, that is the same things. We just don't do surgeries and other, major things that physicians would be able to do. Where for family medicine, it's really not that much difference in terms of practice.
At one point about 4 or 5 years ago, I switched PCPs because the PCP that I had at the time, one day I was in his office, he was with Piedmont Physicians. Anyway, I was in his office and it struck me that even with and he was a nice person, but with all of his medical training, all he could do for me was triage. I mean, here's kind of what's going on, go here, go there. But no direct treatment for something that, in my mind, was simple enough that could have been taken care of right in the office.
Mm-hmm.
And I thought, here he's put all this time and education in, I'm certain that he knows more, and he could have done more in his office, but limited because of the practice he was in.
Exactly, and also it has to do with, more of that has to do with reimbursement. So, yes, he can, but if he just focuses on his little part and sends you somewhere, you're taking less of his time. Somebody else can bill you for the same thing that he could have done, so it can free him to see other patients. I have like, I don't see pregnant women, but I'll see a pregnant woman come in every once in a while, like, oh yeah, my OB sent me because I have a sinus infection. There are doctors, you can treat a sinus infection as an OB. Why would you send this patient to me in primary care to give him amoxicillin? You know, but they don't want to mess with that because they have to see their OB patients and make them be able to make their money. So sometimes it's the time and the reimbursement factor and how many they have to see per day just to make ends meet. So use that comprehensive care.
Speaking of,
Oh, go ahead.
speaking of making money,
Yes.
as part of the reason why you're here, could you share a little bit about your panel size and what your aspirations are? And also, in terms of nutrition and other things that are more business-based?
So it's very interesting. My practice started during COVID. So, you know, I was gearing up to open up, and then COVID hit. So, you know, we weren't able to see anybody for like 2-3 years. 2.5 years, we were like, you know, social distancing, with masking, everywhere was closed. We didn't have access to care. So it became a telehealth practice by default for the first 2 years. So my patient panel, I have a lot of telehealth patients, about 1,000 telehealth patients. But my membership is now growing. I have less than 100 members right now for the in member. So I'm licensed in other states, 7 states: Washington, Florida, Arizona, Texas, Georgia, Maine, and Colorado. So I do telehealth for those states as well, urgent care, wellness, things like that. So because it was like telehealth, that's how it started. That's where my patient base is. But now I'm trying to grow the local inpatient membership.
So you're trying to build your panel?
My panel right now, yes, sir. I saw a hand back there.
When did your office open in Peachtree City?
My office opened in Peachtree City in May. I used to be in Stockbridge and then moved to Peachtree City in May, the end of May. So I'm fairly new here.
When you do a group practice, like I know of a business, and we looked into this for a while, that doesn't have any insurance right now for the 20-some people.
Yeah.
If you sign them up as a business, can you bill a membership fee to the individual people that choose to do it? So like the business couldn't afford to provide it, but we wanted to offer it to any individual that wanted to sign up.
So you can do it several ways. Some businesses take on the full cost. Some businesses pay 50% and then the employee pay 50%. Some people just offer it as something that as information, something that they can sign on to and pay on their own. So it just depends on the business and what they're willing to do and what they can afford for their employees.
Do you do presentations at small businesses, like some Valerie or this woman called and said, hey, can you come speak to my small business and all my employees and explain what you have available?
I'm going to start. I'm actually speaking at the brokers thing on the 16th, and I'm talking to a bunch of brokers, and so they are, you know, it's time for them to sign on November 15th. And so they want to hear, because DPC is really coming up and they work well. There's an insurance company called Mending that is coming in January, and they are paying for DPC as part of their premiums. So if you are a member of Mending Insurance, they will actually pay us the membership fees for their members. So I think it's the future. It's just kind of, in Georgia, I think it's very slow growing, but there are other states where DPC, you know, is well understood and it's taking off.
I was gonna just say, I had noticed that your Google business profile was really well built out, so I was like, somebody's really been in there. But I also noticed that I didn't see paid advertising, which is fine. But I was thinking, you used story at the start of your presentation, and that really drew me in. And I was missing that when I was looking in your social feeds and on your website. And I just wanted to really encourage that story-driven approach to weave more of that into your online presence, because it really draws people in. And then kind of that disruptive content that shows, you know, here's what blood panel costs with insurance, and here's what they pay with me, and things like I had questions about you know, you don't have to pay for, if you're sick, you don't have to pay for that exactly. Your wellness is covered, but then your sick is covered as well, which is nice. And so having that kind of myth-busting content out there to just help spread awareness to this model would be really important. And then Steve does he does marketing with story, like, you know, company story, overall stories, and he'd be worth talking to as well, because when I looked at your site, also I read little things in your bios, yours and the physicians, that I was like, I want to hear more about that, because, you know, if we're feeling like we are signing up for something that's also bigger than just our primary care.
Right, because I don't refer out for everything, because
Right.
I can take all the extra things that primary care would normally just refer out, but I try to like manage most of the things in-house.
Yeah, those stories are gold. So.
Thank you.
Question. So if there was a physician or entity that wanted to be a part of DPC, and I know you had mentioned the call at 12 a.m., right, with the patient who had the angioedema, how would it affect the work-life balance of that physician or entity that wanted to join? Like, are calls triage? Like, I'm sure, like, on a patient's end, you know, it's in their benefit that, you know, everyone's so available. But how could you market this to somebody such as a physician or NP that wants to join?
I mean, for me, when I say you can call 24/7, I mean 24/7. So,
Okay.
and you don't get angioedema calls every night. Those are rare cases. And, you know, as part of the initial consultation, we talk about how everything works and, you know, the amount of access they have to me. But I also tell them to be respectful. Don't call me at midnight for a rash that can wait 9 in the morning. You see what I'm saying? But if you can't breathe at night, please call me, and so that I can figure out what's going on, if you need to go to the ER or whatnot. But so, and patients are typically very respectful of that. You know, I've not had any issues, you know, where people are just calling for running noses at midnight. You know, so yeah, it's typically not an issue.
You look really, really well rested, so I believe you.
Well, I stayed up all night for her that night, because I'm like, you know, it's a huge liability, you know, and I told her, you know, I'm telling you to go to the ER, because if you stop breathing, this is an automatic admission to the ICU, just because airway, you know, it can change anytime. So they will admit you to the ICU automatically, and there goes the bill. So, but the fact that she was right there, if she needed that service, she could go in. I gave her the steroids, all the gamut for her to take. And
You told her to go, so that's all right.
Yeah. And I had witnesses, because her coworker was right there. I was talking to them both and everything.
Yeah.
So, yeah. So I did stay up all night. I was so exhausted the next morning, but I haven't had that incident that bad happen in a long time.
You've talked a lot about how DPC works really well with catastrophic type of insurance.
High deductible plans.
Yeah, so this is not advice to anybody, I'm just telling you my own personal story, is that we chose to go with a health share instead of a high deductible or catastrophic insurance. Are you familiar with? No? Well, Liberty Health Share is the name of the one that we've chosen to go with, and I mean, for my entire family of 5, it's, I think, $920 a month, and our family annual deductible is $3,000.
Is that like an HMO type, like a Kaiser type of thing?
No, it's a ministry, it's a Christian ministry type of thing. I really, honestly, I've been a member for so many years, I should be able to explain it to you. All I know is that I submit every medical bill to them, and they
One of my
pay me
patients
back.
told me about it. You pay towards for others. Like
Yeah.
you have a-
Yeah, it's like a commune. When I was growing up, my dad was a pastor, that's all we ever had.
Yeah, it's just like that.
It's the way insurance started, like hundreds of years ago. That's how insurance started. Yeah.
So with Liberty, the amount that I pay for my DPC, I get 60% of that, or 50%, I get 50% of that back. So that helps even on the monthly side. Can you imagine getting a discount on that low number? But then all three of our deliveries were 100% covered. Colonoscopies, I mean, everything that we've ever had to do. There are some things you have to get like pre-approved for. But I mean, it's been really wonderful. So I don't know, $1,800 is a real number, and that number is scary to me. Paying $920 to cover my entire family, and we have never had an issue. But again, that's not advice, that's just our story. I'm sure other people have other things to say about it.
That kind of service saved my dad's life.
Really?
Did I hear you say that it covered your colonoscopy?
Yeah.
But it doesn't cover mammograms? That's kind of.
Oh, no, I think it does.
It's not insurance. It's not insurance. It's different.
I didn't say it. Did you say something about it? No.
She said that program doesn't cover mammograms.
No, I'm saying your DPC membership does not cover mammograms.
That's a membership, right? So what I pay Liberty Health Share allows Katie to go and get a mammogram covered through our Liberty Health Share. Basically, we go to the counter, we say we're self-pay, we pay whatever that lower amount is, and then we submit that bill to Liberty, and then Liberty pays us back. So she can absolutely go and get mammograms and get them covered.
Yeah,
but-
because Anthem is not covered. Or you can drive up 50 miles away.
I have a sort of devil's advocate question. Is there a situation in which you say that would not be a good client or patient for me?
Oh yeah, like somebody that's on dialysis. They have an end-stage disease. They need, lots of care. They are too sick to be the DPC. Somebody with cancer, stage 3 or 4 cancer. Somebody that's like really, yes, high-level care. You need a whole bunch of specialists involved. I'm just going to be like the little 1%.
Someone on cancer, did they still use your services?
Yeah.
You say the prescription drugs?
Yeah.
Because if you spend $99 a month and get your prescriptions for 1/10 of the price.
Yeah, for certain medications.
Okay.
Now, like your cancer is infusions, and it needs to be ordered through the oncologist, and so it gets, complicated.
Well, everybody, thank you all for your amazing contributions. With that, I will end, and I look forward to seeing everybody on Friday night, and then back here Wednesday morning.